New tonight at 6, we have new proof the flu strain is hitting harder than years before, but it's not the worst we've seen here in North Carolina. Good evening. I'm Steve Daniels.
And I'm Tisha Powell. 20 more people in our state have died from the flu, bringing that total so far this season to 95.
This is really important. We're putting this in perspective for you. Last year, 23 people had died at this point in the flu season. In 2016, there were only 2. And in 2015, another especially bad year for the flu, 163 people had died in North Carolina at this point in the flu season. That's 68 more than this season.
Meanwhile, the sick season is peaking with norovirus and head colds also going around right now. This chart being shared hundreds of times since we posted it on the ABC 11 Facebook page. People still trying to figure out the different symptoms between a cold and the flu. Dewan Hogard has been talking to doctors all day long. He joins us live from the Department of Health and Human Services in Raleigh with what he has learned tonight. Dewan?
Well, Tisha, while it may feel like you or perhaps everyone you know is getting sick this season, one doctor I spoke with at UNC Hospitals says it's just average, but he also says it's not a reason to take the flu lightly. Here inside the Passport Health office in Cary, prep work is underway as tomorrow the business is offering 1,200 free flu shots.
There are still people who refuse the vaccine. For whatever their personal choices are, they're not getting it. But I would say more than half of who we see are happily accepting the vaccine.
The service being provided as this year's flu season is hitting folks hard.
15% of all the people coming into our hospital emergency room here have a flu-like illness.
But what's cause for concern is who is getting the flu this year.
The most at-risk groups generally under one or 2, but particularly under 6 months of age and people over 65. What's different this year is we're also seeing quite a few cases in people 50 to 65. And for the most predominant strain, the H3 strain, quite a number of cases in people who are 19 to 49, which is unusual.
Schools and daycares are closing as a result of children having the flu. Dr. Weber saying it's beginning to put a strain on staff resources.
What's really striking is the number of cases we're seeing of influenza. And of course, the other viruses are also peaking at the same time. So that puts a big burden on emergency departments, schools.
His other admission is should this year's flu trend continue upward, the results could be especially noteworthy.
We're on track to be the worst flu year since the 2009 pandemic.
On the other hand, he offers an outlook with a historical perspective.
We'll have an initial wave that will be in January, February. It'll die down, but then late March or April, we'll see a second wave, often of a different strain of influenza.
And one of the big questions that we get when we report these numbers is of the people who have the flu or of the people who have died, how many of those folks actually had the flu vaccine? Well, I did ask Dr. Weber that question. He did not have an immediate answer for me. He says it's something that they compile at the end of the flu season, but he does say there are people who pass away from the flu or even have the flu virus who actually had the vaccine, but he does note that no one actually gets sick or dies from actually getting that vaccine.